As the next Medicare enrollment period approaches, seniors face a wave of new challenges, including crushing inflation, higher cost of living, and impending Medicare changes from the Inflation Reduction Act. Joining us now to discuss is author and Medicare expert Ari Parker. So what are the costliest mistakes seniors can make when choosing a Medicare plan?
Thanks for having me. The costliest mistake I see year in and year out is that people don't shop all plans. The Medicare annual enrollment period is right around the corner. It begins October 15th, and this is your opportunity to shop across all your Medicare options for 2023. What people may not realize is that there are hundreds of insurance companies offering thousands of plans, and there's massive differences across each of these plans. When you're not on the right Medicare coverage, it'll cost a fortune and your health could suffer. I know this firsthand. My dad's health went downhill as a result of his Medicare decisions. That's why I started a company. The company's name is Chapter, and we've helped thousands of seniors avoid costly Medicare mistakes. Then I took these experiences and I wrote a short book titled It's Not That Complicated. You can find it on Amazon, and it'll help you navigate changes to Medicare.
And can you discuss the impact of the Inflation Reduction Act on Medicare?
The big changes from the Inflation Reduction Act won't go into effect until 2 years from now, in 2025. That's when the maximum out-of-pocket cap on prescription costs will kick in. It's a big change, it's really significant, but it's 2 years away. So what that means for this year and for next year is that there's lots of savings to be had. Not all prescriptions are covered equally across plans. The prescription name matters, whether it's a brand name or a generic, and the pharmacy that you go to will impact the price as well. Now, here at Chapter, we help you search across all your plan options, and we typically save our members $1,100 per year just by reviewing their prescriptions and making sure that they're on the optimal plan.
And what are some of the misconceptions when it comes to Medicare?
This is a great question. The biggest misconception is that your broker has your best interests at heart. Your broker doesn't have access to every single Medicare plan, and most brokers say they work with many health insurance companies, but then they define many as 3, or they only work with a handful, or perhaps they're even captive to just one health insurance company. You know that there's hundreds of different health insurance companies offering thousands of plans. You wouldn't go to just one car dealership to determine the price of a car. So don't make the same mistake with whether your doctor is in-network or out of network. Shop every Medicare plan that's available to you.
And do you have any resources that can help seniors navigate these healthcare decisions?
I do. The first is my book. It's Not That Complicated. It really isn't. And you can find the book on Amazon, or you can head to the website, askchapter.org/Ari.